Hello, my friends. Today I've got a short, gentle routine for you to help you deal with sore back tightness or achiness around this lower back region, maybe mid back region. We'll be working on the whole cervical, thoracic, and lumbar spine to create a bit of movement, bring the blood flow to the tissues, especially if you've been sitting for hours, if you woke up feeling off, or if you've been driving for a long time. Ladies, for you, I would strongly recommend this short routine during your luteal phase while you're dealing with menstrual pain. You will need a block and a band. Let's get started. So bring the wrist below the shoulders, knees below the hips, and as we normally warming up, start segmenting the spine, going through flexion. Pull your chin to chest, and then tailbone to ceiling, and segmentally moving to extension without collapsing. And again, exhale to flex. Extend. Extend one more time. Okay, next one, we're moving to rotation. Plant your left hand on the ground, twist your trunk towards the right side and towards the ceiling. We'll be doing threading the needle movement, reaching underneath the abdomen, bringing head or ear towards the floor, and then push up. Exhale as you're twisting. I'm rounding my back slightly. Push up and twist. And then stay on the ground for this stretch. You can hold this for as long as you like. Prioritize breathing and make sure this position is sustainable for you. So change sides. I'll be turning in opposite direction. Again, over to the side and then back down. Final twist and stay on the ground. Round your upper back ever so slightly. And come up. Come to seated. If your hamstrings are really tight, you may want to sit up on the cushion or block. Okay? We're moving on to rotation. So we start from here, sitting nice and tall, and then rotate to one side. And start with your right. Start with a little rotation of the thoracic spine. Back off and go deeper. And then go for one more. And then back to neutral. Breath in. Rotate over to the left. 3. Back off a little. 2. Back off a little. 3. Back off all the way. All right. Exhale. 1, 2, 3. Regroup. If you need to bend your knees a little bit more. 3, 2, 1. Return. One more time each way. 3, 2, 1. Turn. Final. Lovely. And return. Rest your hands. Stretch the legs. So you may want to stay in this position. We'll be using a band next as we want to increase the stretch through QLs, through the posterior tissues of the back, like a erector spinae, muscles between the ribs. So I will go into this position, which you may want to opt out or opt in, see what you feel is right. I'm turning to my left leg so I can bring my right shoulder towards my right knee. This already puts me in the side bending position. Now to reinforce the stretch, I'll be wrapping the band around my right foot. And again, depending on how your shoulder is feeling, you may want to reach overhead, or maybe just reach in front of you. You can shorten the band, or if it's uncomfortable in the hip, just keep your legs straight. This is absolutely fine. On the inhale, I rise up a little. On the exhale, I'm trying to rotate more towards you and side bending towards my right leg and towards the ground. Again, for some of you, the stretch may just look like something like this or something like this, and that's absolutely fine, provided you're feeling a stretch in these tissues and not pain either on the opposite side or central pain around the lower back. Give yourself a minute, 90 seconds, depending on, again, you're feeling those tissues are relaxing. And then slowly rise up. We're going to do the other side. So again, I'm turning to my right so I can side bend to my left. And it's absolutely fine to stay just in this position or this position. Gently applying pressure onto the head to create a bit more side bend. If this is manageable, grab a band again. And add a little bit more depth. On the inhale, back off a little. On the exhale, I'm trying to deepen the stretch. And return. All right, so now, instead of just simply stretching the tissues, we're going to go into activating, so contracting, lengthening, contracting, lengthening, so that we can actually influence fluid dynamics, which means we bring the blood flow to the tissues. So from here, grab weights, okay? I'm using 5-kilo dumbbells, and I'll be sliding one dumbbell towards the knee. I'm just going in a side, in the same plane. I'm just going sideways, and I'm lengthening through oblique on my left, contracting, side bending, contracting. And the breath is the most important part of all this. One more time. Breath in, breath out. Perfect. Now continue with the lower back. We're going to go onto the side kneeling, into the side kneeling position. Set yourself up this way, arm overhead, and we sort of creating even deeper side stretch, obliques, because again, obliques and QLs, erector spinalis, those muscles that connect pelvis with the rib cage, so a lot of stiffness comes from those tissues. I like to fold gently, fold towards the ground, and then open up. Exhale to close, inhale to open, exhale to close, inhale to open, and repeat as many times as you feel necessary. And then we change. Back to neutral. And fold. Open. Brilliant. Next couple of drills will aim to really activate the deeper paraspinal muscles. So start on your hands and knees. So simply by activating deep back muscles, you may feel a bit of relief. Simply holding this position. Now see if you can add the circular movement through the shoulder and the hip. So arm and leg move through the same range of motion, the same pace, same shape, same direction. Pause and change direction. I'm going counterclockwise now. Trying to maintain that core stability, pulling the rib cage up towards the ceiling. And relax, change sides. It doesn't even take that long, really. You just set yourself up, take a deep breath in, and circling. So we're going clockwise with arm and leg, same pace. I'm really pressing down hard through the left hand. Don't let the ribs flare open to the ground. And change. We're aiming to keep hips square to the floor and shoulders square to the floor. So now we're going in reverse, okay? This should be a nice challenge for your coordination. And then relax. Now come down onto your abdomen, lying down in a prone position. Arms overhead. And again, we will be activating posterior muscles of the body. Deep breath in. And exhale, lift your right arm off the floor and your left leg. Your chest lifts, however, your left hand and right leg stay on the floor. So you've got this X-shaped position with a diagonal contraction from the right trapezius through the extensors of the back, through the left glute, left hamstring. Come down. And again. So we're doing exact opposite of sitting. We're doing hip extension, spinal extension. And that's all it takes. We're not going for any more advanced position. If you're just looking to feel better, this is plenty. I would strongly recommend this to any one of you that have a sedentary job. You on your feet a lot as well. This is again basic strengthening, back strengthening, posterior chain strengthening exercise. Perfect. All right, guys, and then push up. We're heading into the next one. So in this stretch, we'll be working on the psoas muscle. So very simple lizard lunge. I'm having my hands on the inside of my right foot. Gonna add a bit of rocking side to side. And the reasoning behind doing this stretch is, apart from the fact that when you're sitting, your hips are naturally flexed, right? We're using flexion and spend probably more than 90% of our day in flexion with those hips contracted to the front. So it's a good idea to always create a bit of an opening. Also, your main hip flexor, your iliopsoas, has actually attachment to your lumbar vertebrae, which means they can tug on that lower back and can cause lower back discomfort. So good idea to incorporate this stretch into your daily routine. You can, of course, deepen this position a little bit more, if that's okay. Or if this is too much, come up onto the blocks, like this. Or come up even higher and rest your forearms on your thigh. Always aim to tuck tailbone under slightly to create a bit more length in the lower back. Again, give yourself time. Focus on good breathing, inhaling through the nose, exhaling through the mouth. Change sides. Step your left foot forwards. Because when you're holding a stretch, really the idea is that you're searching for a stretch. So me being in this position may not be the same sensation as any other person next to me. So you may want to move your upper body around, maybe deepen your position, go further forwards. Or maybe you back off a little bit because it feels better in the hips and you tuck tailbone under, okay? This stretch equally could be done from here and just tucking tailbone under, leaning backwards. So it's a little bit, this is a smaller angle in the hip, especially if you feel gripping. Anywhere from here to here to here, down here. Pick your poison. Okay, let's move on to the last drills to help that lower back feel better. Simply lie down on your back with your arms outstretched. And before you twist, it's always a good idea to slide the pelvis an inch to the left before you rotate or send those legs to the right. You end up with left hip stacked over your right. It's just a much more intense stretch through the lower thoracic spine. Soften through the shoulders. Hold for much longer if necessary. Okay, if you're about to go to the left, slide your pelvis inch to your right, and then legs fold to the left. Maybe apply a bit of pressure with your hand. And on the exhale, soften through your shoulders. That's it for today, guys. Thanks for watching. See you in the next videos.
Please share, like, and subscribe for more content. And if your lower back gives you trouble on a regular basis, try this short video on hip stability.